You think you know everything when you graduate, and then you realize dentistry just doesn't stop. You want to be spiritual, not ritual. It's the same thing with dentistry. Find your niche, see what you enjoy, and just practice things and change things up.
I spent a lot of money trying to invest in improving my skills, and this was one of the boxes that that we were given on that course. And I generally felt a lot more confident. And I guess the message that I have for the young dentist, for generally anyone in any sort of whatever you're doing, whatever you find difficult, keep practicing, keep doing it, keep doing it, keep doing it.
What he can see and the level of detail is insane. And I think if you're doing really high-end composite veneers, ceramic veneers, even just a normal class 2 filling, being able to go 20 times zoom.
So sometimes you get teeth even below bone sometimes, but with the sharp luxator and the correct pair of loupes, you'll be able to take it out. But with the refractives,
that's one of the things. When I was in dental school, I actually got called out by my tutor, who said that I don't think Muhammad knows what he's doing when he's doing root canal, right? So I was actually really grateful for that, because it was true. I felt a bit overwhelmed. I felt like I didn't know what a canal felt like, because theory is different to doing it in real life.
Hey guys, welcome back to the Bright View podcast. You've heard a bit about how we survived dental school. Now we're going to discuss how to survive, or how we survived foundation year and beyond.
The Bright View podcast is brought to you by the Bright View Accountancy. If you're a newly qualified dentist or in the first year as an associate, this one's for you. Bright View Accountancy are specialist dental accountants who work only with associate dentists, and they offer an amazing first year discount to help you get started on the right foot. From your first pay slip to your first tax return, you'll get clear advice, full support, and accountants who understand exactly what new associates need. You can book a free 30-minute consultation with Brightview Accountancy with the click of a button. All the details are in the comments below.
So I'm Dr. Marwan. I'm joined with
Dr. Hussein
and Dr. Muhammad.
Let's get straight into it.
Right, let's pick the first item from the box. Are we going to do the same thing, guessing?
This time hopefully we have to guess correctly, because we sort of figured out very easily. Let's see, hopefully it's a little bit more challenging. Right, let's start off with these car keys.
Well, the RS3 keys. It's Marwan's. Bro's flexing.
No, it's just normal keys. Anyway, the reason why, so the car keys are mine. The reason why I put the car keys there is because moving to Manchester, you need a car. It's not like London, you can get away with public transport. You know, TfL is great, and I don't think I appreciated it when I was here. But now that I've left London, kudos to TfL. They do a good job. So I'll give you an example after work.
Sorry, can I just stop you? Do you think the train drivers need a rise in pay now?
Yeah, I support it.
You support it, yeah?
Yeah, well, they have the right. They have the right, yeah.
I think, would we not want more as dentists? Let them do their thing.
But I do need to get to work in the morning.
Not if you have a car, you don't need it. It's fine.
Yeah, I'll be honest, I don't actually drive.
So yeah, that's why I support it as well, because I got a car as well. I drive to work.
And every time they strike, I'm in money, so it doesn't really affect me. So
it affects us though. The traffic.
Sounds like you.
The traffic's crazy. Yeah.
But so I'll give you an example. So in Manchester, I live in Stratford, which isn't too far from
Old Trafford.
or the Trafford Centre. And so normally after work, I would go there to get food. With public transport, I'd have to go to the tram station, and go there. It would take me 40 minutes. So 40 minutes there, 40 minutes back.
Hussein, do you know what he needs?
Do you know how long it takes by car?
What does he need?
10 minutes, but do you know what he needs? A Maggie Stocky.
You need a Maggie Stocky.
You think you're funny, don't you?
You don't need a car, Maggie Stocky.
If you want to know the recipe, let me know.
Recipe.com.
With me, I've been stubborn. I don't cook. I eat out.
You still don't cook?
Still don't cook 3 years later.
You don't take
Guys,
you don't take container.
you need to get on the wave.
No,
You don't
no,
freeze
you know
the
what
food
it
and
is. It's
take it
because
out.
I book Airbnbs or hotels. I don't have my own place over there, and I don't really want to cook in someone else's thing. Anyway, so yeah, it'll take 40 minutes. By car, 7 minutes.
Wow.
It's the you
London's
need
the
a
other way.
car.
London's the other way around. The
Yeah.
tubes are always quicker than driving.
Exactly. So
No,
that's
but
why
it
I picked
depends
the
what your
car
tube
keys.
is. For me, the walk to the train station is
Oh, is it
only
hefty?
like 15 minutes.
I see. I'm very lucky. I'm like next
Yeah.
door.
But here's what you do. So with me, I've got a cycle hire membership, £60 a year with NHS. You can get like a Santander bike. I have one outside my house, and there's a docking station right outside the train station. So instead of walking to the station, I'll take the bike to the station and then just dock it in. It'll take me 2 minutes instead of walking for 15
So
minutes.
this guy is a triathlete. He runs, he swims, now he cycles.
He cycles. What do I
And
not
makes
do?
perfume.
I don't eat perfume. I don't eat.
And he rejected medicine for the aura.
Rejected medicine
Rejected
for
medicine for
aura.
aura.
What a guy. Bro is him.
So how's the car journey? Like,
Okay, no, okay. I take it back. So I don't drive to Manchester because I hate long drives. So I take the train to
he
Manchester.
picks and chooses, man.
No,
This guy's living life.
But I have a car in Manchester to go around Manchester. So you need a car when you're in Manchester, but I wouldn't recommend driving up and down because the drive from Manchester to London could go 4 hours, could be 5 hours, depending on traffic. So yeah, the drive to Manchester will take 4 to 5 hours, whereas the train it's only 2.5, so it doesn't make sense to drive to Manchester.
Do you know, I did that
Yeah.
every week.
Don't
So
know how you
after
did it.
COVID, right? Remember how I said we only used to have clinics that we used to go up to. So I never moved out, right? I'm talking second and third year of dental school. I never moved out. So what I used to do, my
Wait, your COVID was in second year?
second or third year.
We
Yeah, I was the
didn't. My COVID was third year.
Sorry, it was my first year. So
Wait, so
you
what year
would-
did you graduate?
Wait, no, you
23.
graduated the same year as
No, but
me.
I'm a mature student, right?
So you did 4-year degree.
I did a 4-year degree.
Okay,
So my first
that,
two.
that makes
So
sense.
the first year is second year.
Mm.
The third year is like a normal person's second year, if that makes sense, right?
Yeah.
So first year, COVID happened, right? We did our exams at home. The second year, because of COVID, we used to just come in for clinics, right, when we were seeing patients. So that was a dream because every Sunday I used to leave about 8:30, and I used to get to my university around 11:30. I used to book a hotel on for Sunday and Monday. I used to go treat the patients on Monday and Tuesday, and then come back home. So I'd have 5 days at home.
That is beautiful.
That was beautiful.
Could have
But,
started your own perfume brand before that time off.
no, but I didn't have the suppliers.
No,
That's what it
no
is. That's what it is. I don't have connections
Excuses.
See that?
This guy's a triathlete. Perfume. What have you done?
You didn't cook for yourself. You didn't wash for yourself.
No,
you had so much time
you
off.
could have at least figured out the washing machine.
Exactly.
like you could have done that.
He did.
I did. After 1 month.
Exactly.
You had to FaceTime. You had to FaceTime your mom.
Yeah, just
And
the
she
first
helped
few
you.
times, yeah,
There's
that's
no
fine.
harm of calling a
How
friend
else
or a
am I
mother.
supposed
Do you know
to
what?
do
I
it?
actually tried doing the washing machine thing once, yeah. So in halls, there's like a room where you do the washing machine, right? So I thought like it's like at home, you just go, you shove it in. But turns out you had to buy those little, you know, those thingies. So I bought like those Calgon, you know, the powder thing. You pop it on and whatever. No, you need the little tablets, bruh. I like allow that. I am buying tablets. I went home and that was my decision. Like forget the washing, man. I just
So
do
that
it-
put you
I'll
off?
just do it at home. Put me off, man.
It's like one of those when you're looking for an excuse. It's like, yeah, tablets, forget
Oh,
that.
no.
Mum.
No, the truth was I was missing
tried.
home. The truth was I was missing home.
They
so-
needed tablets, right? I had powder.
it's too expensive, man. It's too
we listen and we
expensive.
don't judge. It's fine.
Should we
Right.
move on to the next item?
Yeah, let's go. Let's go. Shall we? Shall you? Do you want to pick?
Okay. Ooh. I'm picking the loops. So we've got some loops here. I actually don't know who this belongs to. We all have loops.
But mine aren't as fancy, so.
Well, it's obviously Muhammad's. I like these. Are these Bryant?
No, they're my Ergos.
Okay.
My Ergos.
Where's the light?
It's in my bag. I didn't stick it
Okay.
on. But yeah, loops. So we're talking foundation year associate, right?
Yeah, cool.
If you haven't got loops, you need to get yourself some loops because that, remember at the start when I said that I looked at some of my work at the start of the year, like last year, and then now when I look at it, I'm thinking, wow, I could do so much better now. Purely loupes are so important because you see better. Things like endodontics, you can't find that canal, you can't find that MB2. It's because we're not looking, right? We're just trying to go through tactile feedback, just feeling it, where the canal is, what sort of sinking in. But I just realized I became a lot more efficient when I started using loupes. Now I started off with Magnification 3. Very soon I had to go to Magnification 6, and that's why I've got my ergo loupes. I know it's really zoomed in, but I don't know. I just 3 wasn't enough.
What's your next purchase? A magnifying, like a microscope.
I'm gonna ask Hussein if he can let me use his microscope.
I don't have a microscope. Well, I've got 2 questions for you guys. Refractive or not? And what mag would you go?
Not refractive.
Really?
Yeah.
Now, these are refractive.
These are
Yeah, these are
refractive. So I'm
refractive.
guessing you would go refractive.
No.
Oh, really?
Yeah.
See, bad I told you, I'm always right.
Why not?
Because I don't follow guidelines. Like, you know how you're supposed to keep your back straight. Sometimes I like to get
you
right
like to
in
cheat.
and
Not
cheat
just
and see.
that,
Like, I don't know, man.
think
It's just a bad habit I picked up over the years,
Mhm.
and I can't seem to break it. Like, that's the whole reason why I went for refractive, just to work on my posture. Because you mentioned something about health,
Yeah,
your
lower
back,
back
and
pain.
I did feel my back was hurting. Like, when you have like a big case,
Yeah.
but I'm struggling to get used to these.
I see. I'm the opposite. So I've been using 5.5 times oroscopic loops, which are the straight. I bought those in 4th year of uni. And
You went straight to 5.5
yeah.
in uni.
And everybody thought I was crazy for
Yeah,
going
you
to
are.
such a high mag.
You are.
It was the best decision. My advice, especially if you're going
think it's a
down
good decision.
if
Well,
you're going down the
Go
restorative
straight
route,
away.
Yeah, go big or go home.
yeah. Look, if you want to go, I would say if you want to go start off with a 2 times or a 3 times, you can go for the sort of more entry level brands. But if you're gonna go for the really good brands like Microscopes, Bryant Dental, I'm sure there's loads out there. I would go higher mag, especially if you're going down the restorative route. If you can get used to a higher magnification, everything's more clear. And I don't think 5.5 are enough anymore.
I've got a question. Do you think it affects your eyesight because you're so focused on zoomed in objects
Well,
in the long term?
here's the worrying thing. I feel more comfortable looking through loupes than like seeing the outside world. Loupes now are like my comfort zone.
So that's my worry, that it might eventually long term, if it strains the eye or something like this.
I don't know. I'll do anything to get those mamelons built right in those teeth. But you see, I don't think 5.5 is enough anymore. So I've bought new ones, which is the Bryant Dental, mainly because they're refractive, and I have noticed the effects on the back. But here's the thing. This is why I think refractive is better and higher mag. Higher mag is generally, I think, is just
Yeah.
the higher you can go, the better.
Mm.
Especially if you want to do super detailed restorative work. I guess if you're doing extractions or whatever it may be, that's a different story. But the maximum I can go. And I know Bryant Dental are releasing a new one where you change them, and I think they're even going to bring out an even more magnified loop. So I've kind of gone with them, but also refractive, because I see now restorative dentistry going down the route of microscopes. So my mentor, he bought a microscope recently, and it's been an absolute game changer. I mean, I haven't used it, but I've seen, I've tried it out. I've seen how he uses it. What he can see and the level of detail is insane. And I think if you're doing really high-end composite veneers, ceramic veneers, even just a normal class 2 filling, being able to go 20 times zoom is insane. And that's the next step. But I think to be able to use a microscope, having refractive loupes at a super high magnification,
Yeah, makes sense.
kind of sets you up to
Because
be
you're
able to
already
use
in
that.
position.
You're already kind of
Yeah.
used to that idea of head up straight, but you can see the tooth. So it's still quite natural to you, and you're already quite used to being able to see the tooth super magnified, so having less field of vision.
But that's what I'm struggling with. I'm so used to just being able to move my head. Now,
No, that's the thing, yeah. Well, this
the
is
mag
the
is
thing.
great. Like, I can see a lot better, but it's just, I feel like I'm so far away.
I think you built. That's because You spent all these years in dental school with 2 times loops that were straight, and you can just go everywhere. So this is why I think I made the right decision of. My advice to anybody starting off would be go high mag, ideally refractive, because you never build those bad habits, and it'll be a lot easier to get used to the next thing.
You know what? I actually now understand
You
your
see
logic,
my
and
vision now,
I
so I'm
see the
not
vision.
crazy.
Yeah, no, I don't. I take that back. I take that
Yeah.
back.
Yeah, my one downside with refractive, number one, as you've mentioned, it limits your motion. You can't move around as much. You have to stay in one single position. But number two, I know I sometimes use, not as often anymore, but sometimes I use loupes with oral surgery. I recommend two things for oral surgery. I don't know if you guys have this, but like a luxator sharpener. So it
Yeah.
sharpens your luxators. A sharp luxator makes all the world of a difference. And sometimes loose. So sometimes you get teeth, even below bone sometimes, but with the sharp luxator and the correct pair of loupes, you'll be able to take it out. But with the refractives, you can't.
I can use
Be,
them for oral surgery.
because for oral surgery, if you're doing refractive and you're standing up, are you going to be looking back as you're taking out
Yeah,
the tooth?
quite
Like, how do
literally.
you do it?
Yeah. Is
It's
well,
technique sensitive, isn't it?
yeah. I mean,
It's what you get used to. Like I'm more like
Mm.
you. I like moving my head around, but
But so
you
how
put
would
in
you
the
do?
you put in the time and you got used to it.
yeah.
So
I mean,
How would you do an extraction with refractive
well,
loupes?
I mean, to put it into perspective, I ha- my principal uses his 6.7 Bryant Dentals and places implants and extractions. Mine haven't arrived yet.
But he's refractive though. Or
The
the
refractives.
refractive.
Mine haven't arrived yet, but I've used my brothers, which are refractive, and I've taken teeth out with them. Yeah, you sit up, you stand up, you get the patient in the right position, and you look up, and you can do everything.
So okay,
Yeah,
that's
it's
interesting.
even if you think about it, like in general surgery, like what medics do, they're probably wearing refractors as well because they're performing surgery like that as well. So I guess it might be something. It might just be that we have to give it a chance a little bit and try it a little bit.
I mean, yeah, I mean, I would argue probably straight loops might be a bit better, but especially if you're doing a lot of restorative work and you're doing a lot of work where you sat down.
Yeah.
I mean, unless you're Mr. Big Bucks and you can afford to have both types of loops, I would probably just go refractive. And I think especially things like implant placements, you could do that with refractives. And this is why I bought the one where you can switch, so you can go reduce your
Control the mags a bit more.
because okay, I agree. Is on a super high mag might be super difficult to remove a tooth. So for that, you can reduce your magnification, and then when you go on to do more fine detail work, you can go to a higher mag. So I don't know. That's my opinion.
Okay.
Fair enough. That's enough about loops. Shall we move on now? But yeah, guys, buy your loops. And if you haven't already, like, share, and subscribe.
We need to get one of these companies to sponsor us. Maybe we can put a little
I feel
deal.
like I've sponsored about 20 companies in this podcast.
Yeah, Brian, we've shouted you guys out.
My Ergo.
Yeah.
When are they arriving? Cut that out.
Right, so we've got an endodontic kit over here. I'm guessing this has clamps and things like this, or what does it have?
So it's got a full endodontic kit in it. So it's got Wave 1 files, it's got Pro Taper files, it's got GP, it's got like irrigant, like the syringes, that sort of stuff. And the reason why I got that box is because, I don't know, for some reason, endodontics was never something that I enjoyed. It was never something that I think I'm the best at. I always think that I could improve. And that's one of the things. When I was in dental school, I actually got called out by my tutor, who said that I don't think Muhammad knows what he's doing when he's doing root canal, right? So I was actually really grateful for that, because it was true. I felt a bit overwhelmed. I felt like I didn't know what a canal felt like, because theory is different to doing it in real life, right? When you're making an access cavity, you can do it on the plastic models on phantom head, it's easy peasy, right? But doing it on an actual tooth where there's caries, where there's old restorations, where there's a tongue in the mouth, whether it's like right at the back of the mouth where you have limited opening, it's different. And for me, even when I was taught it, me personally, I never really truly got it. I understood the theory, but I never truly felt like, yeah, 100% I know what I was doing. So I'm really grateful to one of my tutors in university. She called me out, and fine, calling you out is whatever. Like you get grilled. That's just how it is. But what
Gotta
I
love
was
those
really
grillings.
grateful for is the support she gave me afterwards. She literally told me to come in on a separate day, on a non-clinic day, where there's clinics for the younger years. And she just said, Mohammed, you're going to just do all day. You're going to do endos. And by the end of the day, I actually got endos. I really understood endos, and I had like this was in final year where I had a root canal molar endo that I had to do. So she prepared me really well for that, and I actually smashed that endo. That was one of the best endos like I've done in university. And it was because I had all that practice and all that knowledge. Like, when you're taking your master GP cone radiograph and it's too short, too long, like what would you do? How all those little tricks I learnt, right? And fine. Then, like with most treatments, sometimes you have a month of endos, sometimes you have months where you're extracting teeth and you're not doing endos, and people don't want to go for root canals, or it's just not suitable to do root canals. So I've always had phases when I'm doing lots of endos and they all come in one go, and then phases where I don't have endos. You could go like 3-4 months where I'm not doing root canals. So what I found out is during my foundation year, I had lots of endos and I became good at it. And then as an associate, I stopped doing endos as frequently. It is affected by where you're working, what the patient wants. Some people, they just want the teeth taken out. Some people, they have a stigma about root canals. Some people, they it's just complicated. It's just difficult, right, to do. So I always felt, you know what? Yes, I have had the training on root canal, but because I'm not doing it regularly, it's something that I always needed to work on. And I guess this is why I put this in this box, because I went on a root canal, like a 2-day course where we were just practicing on teeth, trying to do root canal with a specialist root canal tutor. So we learned. I spent a lot of money trying to invest in improving my skills, and this was one of the boxes that we were given on that course. And I generally felt a lot more confident. And I guess the message that I have for the young dentist, for generally anyone in any sort of whatever you're doing, whatever you find difficult, keep practicing, keep doing it, keep doing it, keep doing it. And I guess that's my message. Like with the box that I got here, yes, it's not probably my most favorite thing to do. I mean, when it goes really well, I'm delighted, I'm really happy. But when it doesn't go so well, I'm really stressed out. And for me, it's a reminder to myself that obviously do what's within your scope of practice, but don't give up on it. Keep going. Try and get better and better each tooth at a time. Because it's really important. Your skills, when you start dental school, you barely knew how to orientate yourself, right? In the first year. When you graduate, are you 100% confident that the diagnosis you made is correct? The treatment plan is correct. Yes, we are trained to make the diagnosis, but inside we all have that feeling, oh, am I sure about that? But then that improves as years goes on. And it's these little milestones that you have, and you just got to continue investing. And especially for those in foundation year, whatever you struggle with, do that the most. So if you're struggling with composite fillings, like big composite fillings, rubber dam, do it the most in foundation year. That's the best time to do it. And then carry on those habits when you go into your associate life or any sort of specialty training that you try and do. So for me, this is why I have got the endo box, because it's a reminder. Always try and do the endos where you can do them. And I think for me, sometimes you learn a lot just by doing. So that's why I got the endo box.
Yeah, no, I do. Do you guys still do endos, or do you mainly refer to a specialist?
Well, in Manchester, it's different. In Manchester, there's no pathway on the NHS unless if it's they say the tooth is of strategic importance, but they never get accepted anyway. So it's either you do the root canal or you extract or you refer it privately.
Yeah.
So if they can't afford it, just do the root canal there.
Yeah. So I attempt it if I think it's something that I can do within in my scope of practice. But molars are generally a lot more trickier than like your single rooted or two rooted canals. But depending on the right patient, the right select, like for example, someone who knows that the tooth needs to come out but just wants to try and save it and has a low expectation, like, and I think that I can carry out the root canal, I'll definitely explain all the options like you mentioned. The same in Essex where I work, we don't have a pathway. I explain it, and if they say, Muhammad, just give it a go. And like, I'm grateful for those patients because I have given it a go, and like, I'm getting better and better and better. I still would say I need more learning, but I can say the same with general, like my
Yeah.
composite fillings, my aesthetic work, my well, hopefully in the future implant work. I will never ever say that, yeah, I'm at the level, because you'll always see that technology evolves. There's always a new thing in the market. There's always a new skill, new trick,
Yeah.
new tip for you to learn. So I just want to continuously get better. And one day, well, this time next year when we have a discussion about endos, I'll say, no, I still need to get better, but it'll be a lot better than what it was
You'll
before. And
probably be
that's just
better than
Yeah.
me. Yeah.
that's just how it is.
My opinion on endos is a bit different. I don't do them anymore.
You're even single.
Very occasionally, but I'm in a bit more of a privileged position in the sense of we've got an endodontist in the practice, and
Wow.
we're mainly private. So
Mm,
is most of the endos I refer to the
makes
endodontist.
sense, yeah.
But the way I see it is, when I first started out, I started using the case assessment tool from the British Endodontic Society, and realised a lot of these endos are outside of my scope.
Yeah.
And one thing I've learnt to be very careful of is work within your limitations. And the way I see it is, doing a re-endo reduces the prognosis of the tooth significantly, so the patient's much better off having it done right the first time. And me doing the root canal, as great as I think I am, and I do them pretty well, mainly single endos, but me doing it versus a specialist who
I agreed.
is under a microscope, can see 10 times more than what I can see, versus me with my Bryant Dental Loupes, is that prognosis and the chance of the tooth surviving and being successful is a lot higher with a specialist. And even me having a go, well, if the endodontist has to then redo it, that's more time, more cost for the patient, but also the prognosis is reduced. So my personal opinion is I refer them. And when I first started out, this is a little tip for foundation dentists, is use the case assessment tool. And if you feel like you're capable of doing it and it's within your scope, then do it. But if you feel like it's not within your scope, don't do it and refer it. That would be my tip. And I know it's very hard now because there's very limited endodontists out there, but it's just trying to find a pathway or something. But the last thing to do is do treatment that you're not, that you know in yourself you can't do to the standard
So-
of what.
So you're
Another-
saying that you wouldn't even do the endos?
For me, is if I feel like it's in my scope, I do them. I have done, but very rarely. If I feel like it's in my scope and I know I can do this endo really well, I'll do it. But if I feel like a specialist will, or it's beyond me, I just simply won't do it. And what you'll find is a lot of the multi-rooted ones,
They are challenging.
even the case assessment tool will tell you this is a level 2 or level
Level
3
three,
clinician,
yeah.
and I'm not level 2, and I'm not going to claim that I am. So, I just work within my limitations.
Yeah. I think it's difficult though, because you have a patient clearly in pain, clearly
No,
doesn't want to wait.
extirpating I will do regardless of the getting that's goes without saying. But actually finishing off the RCT, and this goes for any treatment. Ortho, if I braces, I don't feel like I know I know the theory of them. I know how to do it. If I don't feel like I can do it well enough, I won't do it. Aesthetic treatment, if I feel like I can't meet the patient's expectation, or what I can deliver isn't what the patient necessarily wants, I'll refer them usually to my principal, who I know will do a much better job or will know exactly what that patient likes. Pretty much with everything, is I will work to what I can do. It's not just endo. A lot of it is endo, but yeah, ortho is a big one. Another big one is, I'm quite honest with patients, is if I feel like I can't get them that result with clear aligners or something that I can do, I'm just quite honest and say, look, you're much better off having braces or even clear aligners with a dentist or orthodontist who's more qualified to treat you, say, because some class correction needs to be done, or the bite's off, in which case I will refer. So yeah, that's my personal opinion.
What's your opinion, Marwan?
I hear his opinion is valid. As I said earlier, where patients can't afford it, then fair enough. But if there is an option to refer, then I do agree.
Yeah,
Better to
I
refer.
definitely think like the best person to do the endodontic work is the endodontist,
Yeah.
right? But sometimes you're put in a situation where, like, where do you go?
Yeah, those are tough. Yeah,
Those are tough.
those are
What
really
do you
tough.
do? Because there is no pathway under the national health. Sometimes the patient can't afford it.
It's a very difficult pathway now.
And
Yeah.
after you extubate, patient's still gonna come back in your chair after a month or two because it's getting worse or it's breaking or something like that. So for me, I still think like as a general dentist, I should be able to offer it, but my skill set has got to improve as the time goes on with the newer, for example, new files. Okay, before there wasn't all these Pro Tape or Wave 1 files. Now there are, and they're more accessible. Different systems, irrigation systems, like with better understanding. Because I feel like for us, we've got the luxury, right? Because we're in a privileged position where we mentioned before, the patients trust us with what's in their mouth, and we have a duty to always give the best standard of work. And therefore, as generalists, we should try and get better in sort of as many aspects as we can, and then specialize, because it just makes you an all-rounder. You understand dentistry better, because when you understand dentistry better, you can help the patient better, because you know, okay, this is the issue, so and so can help you, or I can help you, and things like that. I think with experience it comes like
No, I agree.
what to avoid, what to challenge, what to sort of is out of your scope, because you know how you mentioned you don't know what you know until
Exactly that. Yeah.
and that's dentistry for you.
Yeah.
Sometimes you're in full of surprises, but
You think you know everything when you graduate, and then you realize
you're
I
at the
didn't know
bottom of the
anything.
pile. You've got a lot more learning to do.
Should we
Perfect.
move on to the next
Let's
one?
move on.
Who's picking now?
Yeah, back to me.
Muhammad.
Barcelona.
Yeah.
Keyring. I don't know who this is.
Who do you think?
Well, I know you're going Barcelona soon, so I wouldn't expect you to have a keyring. Has to be Marwan.
Yeah.
Why?
Again, it goes back to the point of having a balance. So one thing I put at the top of my list of importance is traveling. So after I graduated, things that I couldn't do during dental school because I had to focus on studies, I decided to obviously put more focus on, and one of them is traveling. So I've tried to travel to as many places as I can. One of them being Barcelona. So the keyring is from Barcelona.
I love Barcelona. It's a nice city.
I hate it. It's so boring. Unless
really?
if you club, there's literally nothing to do, and there's no halal food.
I found loads of halal food in
And
Barcelona.
the beaches are not very PG. Let's just say that.
Yeah.
So, but it's warm. It's a nice warm city.
I do. I'm doing my implant training there.
That's
So,
all.
yeah.
Take a speedo.
If you have a reason to be there, I think it's nice. But I don't think there's much to do as a tourist beyond.
You're gonna take your goggles as well,
that is,
and your little hat.
I'll take my
yeah, he'll go
goggles.
to those beaches
With my goggles, yeah, and the speedos.
with his goggles on vibes, as he said.
Goggles and
That's
vibes.
all.
Positive vibes.
Well, I guess you get to travel more now that you're doing 3 days a week. So
I hope so.
What's the plan? Where you're gonna go next?
Well, the plan is to spend time with the family. That's the plan.
Have you got any upcoming trips?
Hopefully, I'll be going to Thailand soon.
very nice.
Just to visit. Well, not to visit family. Sorry, I don't have family that ignore me. Hopefully, I'll be going to Thailand soon. So that would be a nice experience.
What about you, Hussein? Any upcoming trips?
Aside from Barcelona.
Yeah, actually, I'm going to Morocco soon with the friends. My brother graduated university. Last month.
Congratulations.
Yeah, so
Another
big
dentist
news.
in the making.
yes, so I thought let's go to Morocco. He's finally free.
Is he gonna join the Charles Empire?
I hope once he finishes foundation year we get him in with us.
Yeah.
And
He'll open up another surgery firm.
well, yeah, he's gonna have to build just an extension out there, put my brother in there. But no, I'd love to stick with my brother. and work together.
Can I ask you a question? What
Yeah.
kind of brother are you going to be? You know, when he comes and says, brother, I've done this, are you just going to tell him straight, no, that was awful, that was this,
Yeah.
that was...
Or you're gonna nurture
Are you
him.
going to nurture him like...
No, no, I'm gonna be straight up. Yeah. I already like that. I mean, dentistry doesn't stop for me because so in the family it's me and my brother who are dentists now.
How do you
And
got him a mannequin to prepare for when he works with
I
Charles?
did. I use it more than him, to be honest. But it goes back to what you were saying about practicing. I still practice till this day. I recently done a course, which is a composite veneer course by Charles Brandon, and it was about how to layer and translucencies and all these things. And all the dentists there are super experienced, and they've done so many composite veneers. They've been 10, 20 years graduated, and I was thinking, wow, like I need to get to their level. So I've just been practicing every evening how to do it. And I think that's one of my biggest tips is get yourself a model or some sort of mannequin, buy the instruments. You have to invest in yourself. You have to invest in yourself and just practice at home, whether that's if you want to go into the surgical route, suturing, that sort of thing.
But do you have like the hand pieces and?
Yeah.
How much did that cost? The setup?
Because essentially you almost have like a dental chair.
I mean, to be honest, I have keys to the practice, so I just stay after work and I'll just use that. But I also bought an electric motor with a speed increase and handpiece, so I can kind of just move that around. It's just a small little unit, and I can use it at home if I wanted to. Obviously, you have to sterilize things if you're going to use it in real life, but I mainly just use it right now for practice.
Okay, so for example, if there are students listening,
Yeah.
roughly a setup like that, how much would that cost? Or even, for example, like us, like if we want to practice what we want to do and we want to do it at home,
I
how
think
much would that cost,
if
and where
you-
can we get all that?
There's
detailed
so
from?
many different brands out there. I think if you want to practice, is set aside about $2,000 for everything. Obviously, some stuff will be harder to source than others because, especially if you're not a dentist, you need to have a GDC number to order certain products and that sort of thing. But there's a lot you can still do in practice, and sometimes I remember the university. One of the supervisors, he said, "I'll get you some composites from my clinic," and he just gave me some composites, and I started practicing my posterior composites and putting fissures into it. Is for me, honestly, I recommend this to everyone. I don't know why we don't do it enough. Is footballers will go home and practice their dribbling, and musicians will practice their music. I don't know why we only practice dentistry at university or dentistry.
But you know what the issue is sometimes? I don't completely agree with you because I feel like it's also important to be able to switch off. And if you're
Yes.
bringing dentistry home, when are you going to switch off?
Oh, I completely agree with you on that one. If you want to switch off, don't bring a dental unit to the house. But I'm quite an obsessive person, so I dentistry just doesn't stop. I'm quite happy to do dentistry at 11 o'clock at night, and I've been in the clinic at 11 o'clock at night. Recently, the nurses in the clinic convinced me that it's haunted, and I was there the other night, and I did get quite creeped out because it was like late at night, and I was like, "Is it haunted? Is there?" I put a prayer on the TV, and I was fine. I was like, "Yeah, I'm good now. Like that's all okay."
Adequacy, yeah.
Yeah, it's all fixed. But that's what I personally did. Is I bought a dental model and just practiced. And some people want to switch off, in which case leave it at work or university. If you're like me, take it home.
No, I definitely think at some point, like early in your career, put some time into it. Put some time into dentistry, because the quicker you hone these skills, the better it will be for the long run, isn't it?
I feel like you can just never be too good. You can never be too good. I thought I was great when I graduated. I realized nowhere near that. And I still, right now, I think I'm nowhere near where I want to be. And you can always learn new things. I have a saying, which is something that I learned from, actually it was during a religious talk, but I apply it to dentistry, which is you want to be spiritual, not ritual. And what that means is, rather than just doing things for the sake of it, like praying as a ritual, you want to be more spiritual about it. And it's the same thing with dentistry. Obviously, when you first graduate, you are excited. It's your first root canal, it's your first extraction, and there's that excitement there. And eventually that fades away, and all of a sudden it becomes just another filling. And I'm doing the filling the same way I did it yesterday, the same way I did it last year. I'm using the same products, the same technique, etc. The way I do something as simple as a filling today is much different to the way it was 2 months ago. And I hope it's going to be different in a year's time. And that's because I'm always trying out new products, I'm trying out new techniques, trying to improve. And for me, my personal opinion is you enjoy dentistry more. It becomes more of a passion when you're always trying to change things up. And what I found is having new toys is super fun. So I always buy new things. That's for me. That's just me. But I always like to, I see a new matrix band or a new type of fast handpiece or whatever it is. I'm always buying new things. I spend so much money on it. The surgery's cluttered now. And I'm like having to teach the nurse how to use this new thing. But for me, there's just that excitement of ordering something new. I know, I don't know, that sounds a bit sad, but is having those new toys, I just enjoy it. And that would be my advice to any young dentist is find your niche, see what you enjoy, and just practice things and change things up. Use different products, use different instruments, so many different composite instruments out there, and always try to find how can I make this better? Is how can I make my rubber dam placement more efficient, or how can I get a better seal here? How can I get nicer fissure staining? All these things, just constantly try to be a bit better.
Perfect.
Thanks
Thank
for
you
giving-
for listening. We'll be back very shortly.